The average pace of first-dose coronavirus vaccinations is falling once again. After accelerating for the first time in months, the national pace is now down to 206,000 first doses per day. That is the slowest it's been since vaccines began rolling out last December. Meanwhile, the Delta variant now makes up 99.9% of circulating cases in the U.S. But there is some good news. Average daily cases have been going down. For more, I want to bring in Dr. Alison Haddock. She is an assistant professor at Baylor College of Medicine and an emergency medicine physician. Doctor, welcome. Thanks very much for joining us. As we've reported, the pace of new coronavirus vaccinations is slowing again. More than 56% of the population is fully vaccinated, and more than 65% has gotten at least one dose. At what point, doctor, can we say enough people are vaccinated and this is no longer a pandemic of the unvaccinated?
Until we see every person in the United States vaccinated, I'm going to have concerns. I'm hoping we'll drop below pandemic numbers before that. But anyone who is possibly able to get vaccinated, is in the age criteria and is advised by their doctor to get vaccinated, I just really encourage them to do so. That number is dropping, that number of people who are available to be vaccinated. But every shift that I work, I'm able to identify patients who are willing to still get vaccinated.
Well, on Monday, Texas Governor Greg Abbott signed an executive order prohibiting coronavirus vaccine mandates in the state. What do you make of this decision, and do you believe mandates have made a significant impact on the nation's vaccination efforts?
I think there's a lot of different tools that are making a difference in our vaccine efforts and making the vaccine numbers go up, and that there's still a lot of different ways that employers can facilitate their employees getting vaccinated. Some of the patients who are unvaccinated right now are still unvaccinated because they don't have the right day off work. They're worried that if they have side effects, that they'll miss a day of work. And so if there are things that employers can do to help facilitate their employees being able to take off that day, recover from side effects, incentives that can be provided. There's a lot of options short of mandates that can help us increase our vaccination rate in the United States.
Well, an FDA advisory panel will be meeting later this week to discuss and vote on booster shots for recipients of the Moderna and Johnson & Johnson vaccines. What kind of data will they be considering?
The data is still coming out. I don't think that we have completely definitive data on this issue yet. The number one thing that we're focused on still is preventing deaths and hospitalizations. Those are the really bad outcomes that we need to be most focused on. And even the initial doses of the vaccines seem to be doing a good job against that. On the other hand, it's beneficial for others to be able to prevent infections as well, especially if they're around someone that, due to immune compromise or due to being too young, isn't able to have as great of isn't able to be vaccinated or have an adequate response to the vaccination. So I think that those booster shots can pose an opportunity for some other folks too, but that there is some data that we need to assess first before we can make that decision.
Well, the CDC is predicting hospitalizations will fall or remain flat in all 50 states, but there are still some hospitals that are struggling with cases. What are you seeing on the front lines?
In Houston right now, we're seeing a much better situation than we were a few weeks ago. However, our ICUs in the Texas Medical Center are still over 100% capacity. The percentage of patients that have COVID has definitely dropped, and we're seeing improvements locally, but still seeing patients with COVID regularly who are quite sick from it, especially those who haven't been vaccinated.
Well, according to the CDC, some public health labs are preparing for possible test shortages as we enter another flu season during a pandemic. In what ways will this winter be different than last year's?
Yeah, those test shortages are really frustrating because it's a great tool in the toolbox for us to be able to test ourselves so that when we have COVID, we know that and cannot spread it to others. So widespread testing is a really, really helpful tool. And I hope that the shortages that we see won't be so severe that we're not able to have widespread testing of people who are symptomatic or just exposed, because I think that's one way that we can keep ourselves safe this winter and be able to socialize and see family over the holidays, which I know is something that we're all really looking for after this long pandemic.
Yeah, absolutely. So many people looking forward to that. Dr. Alison Haddock. Doctor, thanks very much for sharing your expertise with us.
Thanks for having me.